Let's look into the right side of the sheep heart, and in order to do that, what we need to do is make a cut from the base, which is the superior part of the heart, to the apex, which is the pointed inferior part of the heart, making sure to get the atrium in the cut. Looking into the right side of the sheep heart, we can see the right atrium, which is the chamber that receives deoxygenated blood from the body. Inside of the right atrium, we can see some muscular ridges. Those are known as pectinate muscles. This white fibrous structure is the atrioventricular valve. On the right, it's called the tricuspid valve. It's anchored down by these white cord-like structures. These are the Chordae tendineae. The Chordae tendineae work to keep the atrioventricular valves closed during ventricular contraction, preventing backflow of blood into the right atrium. They anchor onto this mountain of muscle called papillary muscle. This is the moderator band, which helps to distribute the signal for ventricular contraction to the anterior papillary muscles. The ridged appearance of the interventricular wall is known as trabeculae carnii. Looking at the other side of the right atrium, we can see the opening to the superior vena cava. Deoxygenated blood enters the right atrium through the superior vena cava. Here is the opening to the coronary sinus. The coronary sinus empties deoxygenated blood from the coronary circulation into the right atrium. This open chamber is the right ventricle. There's one exit to the right ventricle, and that's the pulmonary semilunar valve. Deoxygenated blood exits the right ventricle through the pulmonary semilunar valve out the pulmonary trunk. This is the pulmonary semilunar valve. This is the pulmonary trunk. The pulmonary trunk carries deoxygenated blood away from the right side of the heart to the lungs.